Okay, I'm just going to demonstrate the use of personal protective equipment in patients who may have COVID-19 or have suspicion of COVID-19. And this guidance is specific to interventional cardiology in Lab 10 at Bart's Heart Centre. Dr. Steve Hamshere is going to demonstrate how we don personal protective equipment in the anaesthetic induction room, how we proceed into the lab to properly gown, perform the procedure, and then remove the equipment, cleanse our hands and leave the dirty area. You'll see that Dr. Hamshere puts on some overshoes. The personal protective equipment that you'll require will be on a trolley in the anaesthetic induction area. For COVID positive patients, you're required to wear a hat, either tie back or pull on, and a mask with face shield, as shown here. Your cath lab lead should already be on, as should other X-ray shielding equipment such as your collar and glasses. When you've put on the mask and face shield and hat, then you can go into the Lab 10 area. And our policy is that we will use standard cath lab gowns and gloves as protective equipment in these cases. So you'd scrub as per normal and use the blue gowns and correctly sized gloves. So when we've completed scrubbing, you'll don a gown as you would normally for a case, but notice here there's two pairs of gloves, and we'll double glove for these procedures, leaving us with a clean pair of gloves when we're doffing our protective equipment. My colleague is already in sterile equipment will tie you into your gown. Again, exactly as we do for most of our cases in intervention. Once you've completed gowning, obviously the patient will be on the table and you'll proceed with whatever procedure is required. The second category of patients who will be on ventilators when they are admitted to our service. And in these situations, we've been advised that we need to use slightly more extensive PPE. And Steve's going to demonstrate how to don the equipment in those situations, and what we'll be using will be an FFP face mask for which you should have been fit tested, and then gloves, visor, then a surgical gown as per our normal procedure for PCI. So the order that these things are put on, first of all you'll see Steve will put on a surgical hat. And now he's going to take his size 16 mask for which he's been fit tested, and that goes over the face as shown. When those are in place, he'll take a visor. Again available on the trolley. When they're in place, he'll go into the lab, and as before, go straight into the scrub area. So now Steve's completed his procedure, he's going to demonstrate the correct order of removing the personal protective equipment. And just briefly, what he'll do is that he'll remove his outer gloves, then he'll take away his gown, all going into the orange waste bags. After that, he'll take his overshoes off, then his inner gloves, and then the visor. When he's done that, all of that will be in the orange bag. Then he'll move into our exit ante-room, in where he'll take off his mask and hat, being careful not to touch his hair. He'll cleanse his hands and then leave the area. Steve will go ahead and demonstrate that now. So outer gloves, being careful to keep those inverted as they come off and rolled into the waist. Now he'll take his gown, which he will bundle so it's inside out. Now the overshoes will be taken away. And removed. And now his inner gloves can come off. And now the visor can be taken away and disposed of. He can now go and cleanse his hands in the scrub area. Just note that he's still got his mask and hat on. And when the mask and hat are coming off, the idea is not to break the strings, but try and lift them off cleanly from the back without contaminating your hair. So moving into the ante-room, which is now our exit from Lab 10. Mask and hat removed. And there's a cleansing station as before, using alcohol gel to sterilise the hands. And I think when you've left this area, it's a good idea to wash your hands again and also wipe down your lead with a sandy cloth before you store it, just to make sure any other splashes are eliminated.